Brachial plexus. At the root of the neck, the nerves form a complicated plexus, which is called the brachial plexus. The brachial plexus is actually formed in the posterior triangle of the neck by the union of the anterior rami of the 5th, 6th, 7th, and 8th cervical and the first thoracic spinal nerves. As these nerve roots has the two rami, means the anterior and posterior rami. But in the brachial plexus, the anterior rami of these nerve roots actually unite, means combine to form the brachial plexus. Brachial plexus has the different parts, means the first comes the nerve roots, then the trunks, then divisions, then the cords, and finally after that the terminal branches that will supply the different structure. As I've already told you, the C5, C6, C7, C8 and T1 are the nerve roots, and the anterior MI of these nerve roots actually combine to form the trunks, and these trunks will actually divide into anterior and posterior divisions, and after that divisions actually combine to form the cords, and the cords finally give the terminal branches. Now we will move to the next slide so you will better understand it. As I've already told you, anterior MI of the C5 and C6 actually combine to form the upper trunk, while the anterior MI of the C7 root will continue as the middle trunk. And the anterior MI of the C8 and T1 nerve root actually combine to form the lower trunk. Now, as the trunk has been formed, trunks has been divided into the anterior and posterior divisions. So the anterior division of the upper and middle trunk actually combine to form the lateral cord, and the anterior division of the lower trunk will continue as the medial cord, while the posterior divisions of the upper, middle and lower trunk, means all of the three trunks posterior division actually combine to form the posterior cords. So you will understand that how the cords have been formed. And now the naming of the lateral, posterior and medial cord, how we will name it. Basically, these cords are in relation to the second part of the axillary artery. The part of the cord, means the lateral cord, actually lies lateral to the second part of the axillary artery. The medial cord actually lies medial to the second part of axillary artery, and the posterior cord actually lies dorsal or posterior to the second part of the axillary artery. So that's how we name these cords. As I've already told you, the C5, C6, C7, C8 and T1 nerve roots, the anterior MI actually combine to form the trunks, and the trunks has the divisions, anterior, posterior divisions, which will combine to form the lateral cord. The lateral cord actually formed from the anterior division of the C5, means anterior division of the upper and the middle trunk, and the middle cord actually from the anterior division of the lower trunk, and the posterior cord actually formed by the posterior division of the all of the three trunks. So the lateral cord will give rise to the terminal branches. What are the terminal branches of the lateral cord? First terminal branch of the lateral cord is the musculocutaneous nerve. Other branch of the lateral cord actually comes from the another branch. One branch actually comes from the medial cord and one from the lateral cord, which actually combine to form the median nerve. So the one terminal branch of the lateral cord is musculocutaneous nerve, and the other nerve is the median nerve, which actually in combination from the branch of medial cord. So the terminal branch of the medial cord is the ulnar nerve, while the other nerves are the medial cutaneous nerve of the arm and the medial cutaneous nerve of the forearm. Now the posterior cord actually give rise to the radial nerve and the axillary nerve, while the other nerves are the lower subscapular nerve and thoracodorsal nerve. So these are the terminal branches which will comes from the cords. The other nerves, like the long thoracic nerve, actually long thoracic nerve, you have to look at the nerve roots area C5, C6 and C7. The anterior rami of these nerve roots actually, the branches of these anterior rami actually combine to form the long thoracic nerve, while the anterior rami of the C5 will give rise to, will give the branch like the dorsal scapular nerve. Other branches are the suprascapular nerve. This nerve actually comes from the upper trunk, and the nerve to subclavius actually will be come from the anterior rami of the both C5 and C6 nerve roots, the anterior rami of these two nerve roots. So you have to understand means from where the musculocutaneous nerve arises, from where the median nerve comes, from where the ulnar, radial and axillary nerve actually comes. So this is the division of the brachial plexus. The roots, as I've already told you, roots are the C5, C6, C7, C8 and T1, while the anterior rami of these nerve roots will combine to form the trunk, superior, middle and inferior trunk, or upper, middle and lower trunk, and the divisions of these trunks will actually combine to form the lateral cord, posterior cord and the medial cord. And what are the final terminal nerves? The one of the terminal branch of the lateral cord is musculocutaneous nerve, and the other is the median nerve. And the posterior cord will give rise to the axillary and radial nerve, and the medial cord will give rise to ulnar nerve and medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm.